You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, he says small improvements made to your smile can make a big difference in your life, how people perceive you, and more importantly, how you feel about yourself. With us, we have Dr. Emigh. Dr. Emigh, welcome to the program.
Thank you for having me.
Now, you are Long Beach's cosmetic dentist,
Yes,
right?
yes, sir.
Now, for people that don't know your practice, I guess you work with your brother, your father, everybody's a dentist, right?
Yeah.
Who's the typical patient and what are the different services you offer?
I mean, our patient base ranges from firefighters to business CEOs to, house moms to, college students. So really we don't have a specific demographic.
Okay.
But people come to us, when they see somebody, on TV with the smile that they want, or they're just not happy with their smile and they maybe feel self-conscious. If they just want to change their smile, be happy, feel, motivated,
okay.
And be able to chew.
Are there a lot of people that don't like their smile?
Well, there are tons. Yeah, tons of people that they don't like their smile, and they don't like talking about it, and you don't see them because you might think that they're just the grumpy person walking down the street, but really they're just not smiling because they don't feel comfortable. They feel like they're being judged.
Is that right?
Absolutely, yeah.
And can you spot people, by the way? I mean, you're a dentist, so you know when somebody's hiding their smile?
It's tough when they're not smiling because you can't see anything, but yeah, I think, when they come in and you see that they're not smiling and they're anxious and whatnot, a lot of times really what's happening is they're just not happy with their smile. I know I did, actually my father-in-law, for example, he's rough and tough, construction guy that doesn't talk much, and at first you might just think, he doesn't want to talk to me, but he was just missing a lot of teeth and a lot of broken down teeth and crowns that they were discolored for a long time, and so finally I talked with him and we worked on his mouth and we got him a great smile, and now he's just, smiling all the time. We're playing with the grandkids. It's pretty fun to watch. And I actually talked to him a couple weeks ago and asked him, how did this change you? Did it change your life? And if so, how? I see you smile with my grandkids and whatnot. And he said, yeah, he just feels like he's not judged anymore. So he's able to just be a little bit more open and happy.
Is that right?
Yeah.
Now, in your family, I guess everybody's a dentist, and it's like you've been a dentist since you were like 10 years old almost, right? Is that right?
Seems like it. Our dinner discussions were about teeth. Smiles, teeth, and dental terminology for days. But we'd sit and watch movies and TV, and yeah, it just.
Your mother's a hygienist?
Mother's a hygienist. My sister-in-law is a dental hygienist. Yeah. My oldest brother and my wife are really the only people that are not in the dental field. But yeah, we love it. We get together and drive my wife crazy by having talks about dentistry. And
now you believe that if you change your smile, and I'm paraphrasing slightly, but that you could change somebody's life.
Absolutely. I mean, Randy, we see transformations every week. People come in and they haven't been happy with their smile. They're not smiling and they want to, maybe go get a job. They don't have a job. And actually, for example, we work with a rehab center, really solid rehab center.
Okay.
And they end up sending, their clients to see us because maybe they can't chew or, their teeth are really, broken down from drug use. And, when we fix their smile, they just feel like they have a new start. They're motivated to kick the habit and really make something happen. And a lot of times I see patients cry in the chair after we're done with them, and
really,
and I tear up too sometimes after. It's just you have this moment and it's pretty amazing
when they see their smile for the first time.
Yeah, it's awesome.
So at your practice, you do everything.
Absolutely. Absolutely. I mean, we
just cosmetic.
No, not at all. We love cosmetic dentistry, but we do everything from hygiene, cleanings, to whitening, to fillings, all, tooth-colored fillings, porcelain veneers, crowns, root canals. We'll do implants, do a lot of Invisalign. Really, we do bread and butter, but we just are proud of our cosmetic dentistry.
And sedation. You guys are. I know your brother's big on sedation.
Yeah, and actually we've all been trained in sedation. So somebody can come in, get everything done all at once, go home and not remember a single thing, just feel happy.
Is that right?
Yeah, yeah. They just look at their smile the next day or just be like, wow, everything's done. I don't have to worry about it anymore. And these are patients that are coming in or that won't even walk into that door without drugs and to be, just really relieved. So it's, yeah.
So there's no excuse anymore, I guess.
No.
Like the fear of the dentist.
Yeah.
Do you get that, by the way? Like, no offense, doctor, because nobody likes going to the dentist. We were talking about that.
Every day.
Really?
Every day.
And
Every
what do you
day.
say to that?
I say no offense taken. They just haven't, met us yet. They haven't, it's not the older dentist where it's like you got to suck it up and push through the pain. There's no reason you should feel any pain. If you are even worried about if it's the sound or the noise, or you just hate the smell or whatnot, you do sedation. Nitrous oxide, just feels like you had a couple cocktails and you just relaxed. Or to sedation, like I said, where you're awake, we can talk with you, but you just don't remember a single thing and you just don't care.
Yeah, I thought it was funny, or at least it was funny to me. In our green room, you and your brother, who's also a dentist, is coming on the show next. I said, people don't like going to the dentist. And you said, and like unanimously said, no, that's changing. People like coming to us.
Yeah, absolutely. I think well, at least, I can speak for our office. We have a very family-oriented office, and we have a lot of fun. Our patients, we feel like we're friends with them, and they trust us, which I think is the most important thing. So when we tell them that, we need to do this, they trust us. We're able to do it, and we build the rapport and confidence. So, I think a lot of people, it's their first visit when they come in and say, I don't like the dentist, no offense taken. But after that, we work our way in and they like coming to the dentist.
Okay, good. Now you brought photos. What are we looking at?
I did. Well, I brought a number of photos. This is one of my kind of favorite stories. This guy, Brian, really nice, very successful businessman. So Brian here, he didn't like his smile. He doesn't even smile. He doesn't feel comfortable with him smiling. His teeth don't even show. He's trying to hide what's in his mouth. And so we wanted to change that, especially for his wedding when he's got a smile. So if you look at this other photo now, he has spacing there, that little peg lateral, which is a little stumpy tooth. Mm-hmm. They're in misplaced teeth and just really not the correct proportions. So he needed it fast. He wanted to get it for his wedding. So with him, we did veneers. It's actually my brother's patient, but you think it's a great example of what can be done. And he needed it done right away. We were able to do, in one day, essentially, prepare the veneers and put on temporaries, and he walked out looking just infinitely better. He, took him a little while to learn to smile again.
That's right. What do you mean by that? Like they have to learn to smile again?
Because their brain is trained not to smile because they don't feel comfortable with their teeth. And studies show that when you're not smiling, you're not as happy.
Okay.
People that smile more are happier, and your brain is trained to not smile. And so when you have a nice smile or nice teeth that you can show, it takes a little while to actually build up that smile, they've shown numerous studies where even if you hold yourself in a smile with your fingers and you try to act sad, it's a lot more difficult.
You're a dentist.
Yes.
So you probably think, your whole family's dentist, right?
Yeah.
You probably think the smile is one of the most important things.
I do. I absolutely do. It's vital. Studies have shown that good smiles show that people relate to people with good smiles. They think that they're more competent, more confident, just friendlier. So dentists are not, you're on a job interview and you're not smiling, you're less likely to get the job than the next guy that has a smile on his face, is able to show. I mean, look at two twins walk in for the same interview, and they could look exactly the same and they could have the same teeth, but one person's smiling and one isn't. Who's going to get the job?
That's a good point.
Yes. You take any model and you take out their front tooth, they're no longer a model.
Yeah. Yeah.
There's tons of magazines, for advertisements for mascara, makeup, clothes, hair, whatever it is, but they're always focused on the smile. They did a study, Men's Fitness did a study on what are the top things that make, what are you looking for in a mate? And the number one was a nice smile. And pretty much any study or any poll you take, Family Feud or whatnot, smile is going to be in the top 3. So besides all the studies, we've seen patients tell us how important it is and how big of a change it has, been to them. Whether it's they're getting a job now or they're dating, and they feel more successful or they're doing better in business because they're able to smile, they feel happier, they feel more confident.
Do people tend to do this on occasions, like getting married, they're divorced, whatever?
A lot of times they do. We get a lot of weddings You know, people come in and they just haven't been happy with their teeth, and they just needed that little extra push to do something, and the wetting is it. So I know we did, about 2 months ago, we did one, you know, really pretty lady that you know, she just didn't like her 2 crowns in the front, and we redid those, and she sent us pictures with a really nice handwritten note just saying how much it meant to her, and she could smile in photos, and she loved the photos, which she never would have liked before, and she just always felt self-conscious. So yeah, I mean, it changes people's lives, absolutely. So I mean, you look at Hollywood, and you don't see actors out there with bad teeth anymore, you know, except for a couple key role players, you know. But a lot of these people, even like Tom Cruise and Nicolas Cage and everything, you look at their early work, and their teeth were not in great condition, and you know, you might say bad, and then they got them fixed, and now they got these just beautiful smiles and whatnot, and I mean, it's just I feel like it's vital. You know, you can't afford not to do it.
I mean, because your thing, you say this is not for everybody, but if you don't like your smile,
do something about it.
Do something about it.
Yeah, it's so easy. You know, money can't fix everything. Can't make you happy. Can't, you know, do everything in life, but it can get you a good smile. You know, and make you feel good about yourself, and smile does make you happier.
All right, good. Okay, so we have time for a couple more photos.
Okay.
What else are we looking at here?
This is one of my friends, actually. He was terrified to come into the dentist. You know, he just hated dental work, but he had as a young guy in his 20s, he had a set plan. He wanted to get his teeth fixed, meet a girl, buy a house, get married, and with a good job. And so we did that.
So he came to you.
He came to me. We took impressions, did a wax up to show him what it would look like before we even touched a drill to his mouth. So he approved it, he loved it. One day we prepped everything, put tempers on there. He didn't remember a single thing because he was under sedation. You know, a month later, he had a new job. He met a girl in a bar, started dating. 2 months ago, he got married to her. You know, so it's and just he tells me he's just so much happier.
All because of his teeth. He got married, right?
well, I can't quite say it's all because of his teeth, but I'll tell you what, his charisma's out there. He has more energy. He's excited, and he's happy to show off his
confidence.
smile.
Confidence is
absolutely.
attractive.
Absolutely. And I mean, if you look at these pictures, the befores here, you can see he has that spacing in the middle of the teeth that a lot of people have. We call it diastema. He has a little bit longer teeth, a little bit more yellow, and you see a decent amount of gums there. So what we did is really, I mean, our lab is amazing. We use only the best materials. We had them wax it up to just try to blend in everything, you know, and just, I wanted some translucency at the edge to make it really look natural. Correct shape, relationships of the center teeth to the ones besides those, to the ones after that. So now you look at the after, and you see his teeth are symmetrical. They look natural. They're not the big old, you know, rabbit teeth and just boxy teeth that you sometimes see, you know, some
I feel like
veneers.
I could spot veneers walking down the street.
Those are bad veneers.
Really? Is that the hands of the dentist, or is that what people want? That's my question.
You know what? I think I put most of the blame on the dentist, to be honest, because a lot of people think that that's what they want. They think I just want these big old bright white teeth, and you know, I like to let my patient play a role in where they want. I want to know, you know, where they want to go with it. But I feel like it's my job to kind of be the driver, you know, and tell them I don't think that's a good idea. We don't want to make it too white. We want to make it natural. My goal is always to make it so that nobody knows you had any work done except you.
So now, do you see these big veneers then? Because I know I do.
Oh yeah, like I said, when you know, growing up and we'd be watching TV with my family, I'd notice it at age, you know, 12, 14. You know, we're looking and we're like, wow, those are bad veneers, or those are bad dentures. You can hear them lisp, you know. And
so if it's done right, you pretty much can't tell?
You shouldn't be able to
Even
tell
a dentist couldn't tell?
Mm-hmm. My goal is to trick myself. So the next time I'm in there, I'm like, God, I forgot we did these veneers. You know, just, it's a great looking smile.
Are you a perfectionist when it comes to this?
Yeah. It drives my staff and my wife crazy. It's got to be perfect. If it's not perfect, I'm not happy, and I will not cement them if it's not perfect.
What's the process like? Okay, so a patient comes in, they want a smile makeover, or they just don't like their teeth, right?
Yeah.
What happens? I mean, how do you let them know what it's going to look like?
Well, you know, I first kind of talk with them, and I want to know about their life, you know, learn about them and what their goals are, what they do, and whatnot. And then I want them to know, you know, what is your goal? What do you want? You know, what are you trying to look like? What do they say? I want just a perfect smile, a happy smile, you know. And so once I tell them, I know I can give you that, then what I'll usually do, I'll just kind of show them, in their mouth with a mirror and say we're going to do this with this tooth, this with that tooth, make it blend in, look really nice. And then we actually take an impression, we send it to the lab to have them do what we call a diagnostic wax-up, which is really just a mock-up of teeth. And so we bring them back to look at that, and we can actually do that, like put a little mold on their teeth with temporary material so they can actually see pretty much what the final result is going to be on them before we even numb them up, before we do anything, so they can see it right then.
Now veneers, they don't stain, is that true?
No, correct. Yeah. Sometimes if
you have to brush them.
Of course, yeah. Definitely have to brush them. They last as long as you take good care of them, of course. Sometimes people will see really, really old veneers with staining at the gum line, at the margin. That's the only place it could possibly stain, but being a perfectionist, I don't like there to be any rough spot, any discrepancy between the veneer and the tooth. So generally, if it's perfectly smooth, you're not going to pick up stain.
And what about the gray line over the teeth?
Yeah.
Are those veneers or it's older veneers?
No. And a lot of people still do these crowns. They've been around for years, and functionally they work fine. But that's metal underneath those crowns, and so those have to be blocked out. You have to, try to blend those in, but really at the gum line, you can't block it out. You're going to see some gray lines eventually. We don't do that anymore. There's just such better technology out there, better materials, all porcelain. You can bond to the tooth, be less invasive also. But yeah, people still do that. I prefer not to. I don't think it's as cosmetic, and I just don't think it's where we're going with dentistry.
You brought more photos. Let's go to the photos.
This is Alexandra. She is a student at the college nearby us, and she came in because actually one of her past friends now made a comment about what's up with your teeth? Why you need to fix them. And so obviously naturally that she was already self-conscious about her teeth. She didn't want to smile, but
somebody actually said, "What's wrong with your teeth?"
Yeah, it was horrible.
Okay.
So I told her from day one. I said, "We're going to fix you, and you're going to give them a call and tell them, look at my teeth now." So, so we actually did veneers and just a touch of whitening on her, and I mean, just you can see at the beginning she has those two front teeth that just really poke out, and she had some crowding on the bottom also you can't see, but. In about a year and a half, we fixed all that, and she didn't have to wear braces. She just wore clear trays the whole time. People could hardly tell that they're in.
So this was, so you did combination like?
Just Invisalign.
Invisalign?
Really, yeah.
Veneers and Invisalign?
No, we didn't even have to do veneers.
Oh, so this is just
all
Invisalign?
that, yeah, just moving teeth.
Interesting.
That's it, yeah. And very healthy, very easy, pain-free. She's great. So she was super happy. We actually finished her just a couple weeks ago and had a little hug, and she said, "I'm going to miss you guys." And so we're going to miss her too, We told her she has to stop by every so often. So, I mean, you can look at the difference there from the beginning to the end, just how much more sophisticated she looks there, how much professional and just happy she looks. You can see it in her eyes too.
It's like, yeah, it's a good point.
It is.
More sophisticated.
And she was having somebody judge her, and now who's going to judge her on her teeth there except for thinking, positive things about her, and it's similar with my father-in-law. People, he just said people were judging him before, and he doesn't feel judged anymore. This is another case. This guy is great. Just one of my favorite patients, just a real funny guy. He hated that tooth in the front. Just absolutely hated it for so long. It's crooked tooth. I mean, it'd just stand out in pictures no matter how he took the picture. So he didn't want to smile. Another case, we actually only did Invisalign and then a couple little just reshaping at the end, and he just could not be happier. I mean, he's loving it. He can't say enough good things, But we didn't have to even touch the tooth without anything but Invisalign.
Are the patients that are coming in for cosmetic dentistry getting? Is it a younger group, older group, and what are some of the older patients?
It ranges from everything. We've done veneers on 80-year-olds.
Really?
Yeah, and it's not a problem. They just have said, I've always wanted to change this, and I just haven't had the time to do it. So they wanted to do it, and we did it, and I actually did 12 or 14 unit bridge case earlier this year on a lady who's actually, her husband was a dentist, and he did the bridge about 15 years before, but had gray lines and you could see spaces through the bridge. We did it, and she's in her 80s, and she's just loving it, living out in Palm Springs, playing golf every day and just smiling. We see lots of these older patients, 70s, 80s, but I'd like to see more of them, because they've, saved up their whole life, they're doing well. You know, the teeth should last for a lifetime, but it might not be a nice smile for a lifetime. And you know, sometimes they need a little just makeover.
What about the young patients?
Yeah, you know, we're seeing a lot of young patients also. There's a, you know, big working class here, and we're, you know, they're trying to go out and be successful. So they want that nice smile to be ready for the corporate world and just any world, you know, they just want to be able to walk around. This actually is a patient who goes around and he lectures, you know, and he was also, like these other guys, not happy with his smile. He had some spacing, shorter teeth, with you know, staining on those front teeth. Now look at the before, Randy. That's him smiling when he came into our office. It's not much of a smile. He didn't feel comfortable with it. He's got that spacing, the discoloration, and just the not long enough teeth in his eyes. So with this, we did 12 veneers and you know, whitened everything a little bit more, lengthened things a little bit more, had some really nice, you know, masculine contours. And this picture, this after picture, is the day after we cemented him. So he's still not really confident with his smile yet. You know, and it's going to take a little bit of time. It sounds funny, but you know, it's going to take, you know, one compliment, and then he gets a little bit more motivated. Then another compliment to build up his, you know, confidence, and it's snowball effect. Finally, he's just going to love his smile. People are going to be telling him all the time.
He'll be known for his smile.
Yeah.
Okay.
You know, he'll be yeah. Let me show you another patient here. This is Christina. So Christina here, she's office manager at a spa. We actually had to cover the top of her face because she knows a lot of people.
All right.
And so she just totally felt self-conscious about her smile. She didn't want to smile in pictures or even talking with people. So as you can see in her before, she had an old crown on the upper right there. Her teeth were really crowded and kind of tilted in. And she wanted it a little bit longer. I kind of, you know, had to talk with her about what was be most pleasing on the eye. But we did a wax up. We got these really nice, natural looking teeth. I told her from get-go, we don't want anything fake. I don't want any of her clients to know that she has veneers in there. So this picture was about a week after her veneers were cemented, and she's still, you know, still working on her smile, but you can see the difference from the first picture to the second. She's already smiling bigger, smiling nicer. And I talked to her a couple of weeks ago, and she said that, you know, she's taking selfies left and right, you know, and she never would have done that before. And she had just been waiting for, you know, her kids to get done with braces or, you know, school and whatnot.
So on Facebook, like people like this, they're not smiling in any of their photos, and now all of a sudden they're smiling on all the photos.
I would bet if you look at her Facebook, you'd probably see
selfies everywhere.
I don't know, but I think she looks great. Great lady, and I just feel like you can see her self-confidence. And this is a patient where we both kind of teared up quite a bit when it happened. It was a good story.
So when she saw it for the first time?
Oh yeah, that was nice. Do you have time for one more?
Sure.
Okay, this is a patient, and he's a student from a different country, and he came in, as you can see, chipped his two front teeth. You know, trauma, he was in a little bit of pain, so he was wondering just how to fix the pain, and I talked to him and said, let's make it look better while we're at it, you know. So we did a root canal and 2 crowns. And I think if you look at the after picture, you can see that it just blends in. You can't tell anything was done. And obviously, as you can imagine, he's more likely to smile now and feel better about it. Yeah. You know, one afternoon it changed it. He walked out with some temporaries that looked infinitely better than what he walked in with. You know, and then he's just got to cement the permanent ones, and we're done. You know, there's another patient of mine, Michael. You know, Boston guy, great character, but has had a tough life. And his teeth were just really broken down and severe, you know, he's in pain, he couldn't eat. And just a little bit of time invested, and we were able to change his life. He's going out, he's got a girlfriend now, he's got a job now that he wasn't, you know, didn't have a job before. Got his smile done, immediately got a job, and he calls me and just tells me, you know,
is that right?
Thank you, Todd, this is just, you changed my life, you don't even know. And the first time when we did it, he wanted to have it done so he could go back to Boston and have Christmas with his family and show his parents. And so he called me from Boston and just thanking me.
That's very nice. I can even see it, even choking you up right now talking about it. It's very nice. So with these patients, by the way, and we're out of time. If somebody is watching this, they don't like their smile, right? Their fear of the dentist. Maybe it's the busy guy, right, or busy woman. What do you say to them?
You know, I hear all the time people come in and say, my mouth's a wreck. You've probably never seen anything like it. And I know straight off the bat, I've seen more. And actually, I usually think those people aren't as bad as they think they are. But yeah, we can get those cleaned. We can get the gums to stop bleeding. We can get the teeth looking fantastic. You know, no matter how far gone they are, we can make it look right.
Okay, good. We have time for this. And this is a very interesting little photo you brought. I've never seen this
fun.
before.
This is fun. And we actually posted this on Facebook. It's actually an ad from Colgate. And if you look here, Randy, I want you to take a look and tell me what's wrong with each of those 3 pictures.
Okay, well, he's missing his teeth. I'm missing a tooth in every single photo.
Yeah, he has a black spot on his tooth. But really, you look closer, and that's what you notice first, is his teeth. This lady has 6 fingers.
On the very top photo. That's right, 6 fingers, okay.
Yeah, the picture in the middle, there's just some phantom hand on the guy's shoulder.
It's not even her hand, okay.
It's nobody's hand. And then the last guy's missing an ear. I mean, so you notice somebody, some food or a discoloration on somebody's tooth more than you notice them missing their ear. That's how important teeth are.
So when you see stuff, as a dentist, when you see this, this makes your day?
I think it's hilarious, yeah. You know, and it just kind of drives the point home that, you know, teeth are what you recognize first in a person. When you walk in with a smile on your face, people recognize your smile. They don't recognize anything else. That's the thing that makes lasting impressions, that people remember you for.
So not every dentist is a cosmetic dentist. I know it's not a recognized specialty, but this is your focus. You've had a lot of training, I guess.
Yeah.
I mean, is there that much to this?
Absolutely. I mean, people can learn the materials and the procedures and stuff like that, but not everybody has the artisticness to be able to do this.
So there's art. More art than science, you think?
I think cosmetic dentistry, in my opinion, is about 80% art, 20% science. Because the science, I mean, it's there. You know, we all do the same science, or we should be doing the same science. But the art, you know, you can get better at art, but you may not be, you know, born with that or have talent. And I feel like I've been very blessed to have the good skills with my hands and eyes.
You work with your dad and your brother.
Yeah.
Are you better at cosmetic dentistry than those guys? Are you allowed to say that?
I don't want to get started any fights here. Yeah. But we're all great. I mean, my dad's been doing it for 40 years, and that was his first veneer case was over 40 years ago. So, I mean, we have been just eating and breathing cosmetic dentistry.
Well, good for you. I want to thank you for coming on the show. Very, very good.
Thank you,
Very
Randy.
nice.
Thanks.
Pleasure. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.